Let's now speak to Dr. Isaac Bogoch, who joins us from Toronto, who is an infectious diseases consultant over at the University of Toronto. Doctor, good to have you with us. You recently tweeted about the spread of Omicron, touching upon the incredible rate of transmission. As an infectious diseases expert, are you surprised by this aspect of this variant?
It's certainly spreading extremely fast, and we know that we've seen transmissible variants in the past with Alpha variant and, of course, Delta variant. And, it's pretty incredible that we didn't even know Omicron existed a month ago. And right now, it's making up about 73% of all sequenced virus in the United States. Where I am in Canada, it's probably more than that here in Toronto. So it is moving at a very rapid pace. It's pretty incredible to see. Obviously, we don't want anyone to get this infection, but it is moving very fast.
Okay, so a high rate of infection, but we still don't know whether it is stronger or milder than previous infections. But at the beginning of this pandemic, we were talking about during the initial wave, it had put many rich Western countries' healthcare systems on the brink of collapse. Do you fear that we could be returning to this scenario?
Sadly, I do. And sadly, we're actually watching that happen right now in real time. Remember, whether or not this is a more, let's say this variant is, for example, less severe, does not cause as significant symptoms. Obviously, that would be amazing. Everyone wants that. That would be incredible. But even if a small percentage of people require hospitalization or ICU care, a small percentage of a massive number of people that get infected still ends up being a lot of people infected that need hospitalization. And, the hospitals are already stretched very thin, especially there's been lots of attrition of personnel over the last 18 months of this pandemic. Who can blame healthcare providers? It's been terrible working in healthcare. So the hospitals are already stretched thin. So we just don't have the same degree of wiggle room to accommodate a surge of cases. And even if it is less severe, there's still going to be more and more cases that come in just because of the sheer number of people that get infected with this. And I think that's often missed in the general public.
Do you think that we're experiencing some sort of precaution fatigue? I put that in quotes because, if we were to implement the original measures announced by the World Health Organization at the beginning of this pandemic, as well as other world governments saying that we should maintain social distance, we should be wearing our masks, we should be washing our hands regularly, not putting our hands towards our mouths, and the fact that there is a higher number of vaccinated, we should be safe, shouldn't we?
Well, I completely empathize that everyone is sick of this and everybody wants this to go away. We all do. I mean, who isn't? This has been so awful, not just from a health standpoint, but from a psychological standpoint, emotional standpoint, financial standpoint. I think everyone on planet Earth has been touched by this. I think obviously we're in the vaccine era. Even though the vaccines aren't as effective against this as they were with prior variants, they're still effective. They still work. They still reduce significant illness and death. 3 doses is better than 2, but 2 doses still provide some very meaningful protection against severe illness. So I think the policies have to align with the threat. But obviously, I think, obviously there's a tremendous amount of pandemic fatigue. On the other hand, putting our head in the sand and ignoring this doesn't make the problem go away. And we're watching healthcare systems get throttled because of, a wave of infections. And now Omicron's here, and it's just making things worse, unfortunately.
Okay, Dr. Isaac Bogoch, thank you very much for joining us here on the NewsHour. I do appreciate your time.